A new study suggests that lower doses of the antibiotic doxycycline can effectively treat lymphocytic scarring alopecia, a rare hair loss condition caused by the immune system attacking hair follicles. While this may seem like good news, the findings also raise serious concerns about the overuse of antibiotics in dermatology and the long-term consequences of prescribing these medications without fully considering their risks. Doxycycline has long been used to treat inflammatory skin conditions, but its side effects, including nausea, vomiting, rashes, and gastrointestinal discomfort, can make it difficult for patients to tolerate, especially at higher doses. This study, which analyzed medical data from more than 240 patients, found that lower doses of around 20 milligrams twice daily were just as effective as the traditional high doses of up to 100 milligrams twice daily. Patients on lower doses also reported fewer side effects and were more likely to continue treatment. While this may reduce discomfort in the short term, it does not eliminate the broader risks associated with long-term antibiotic use. One of the most alarming concerns is the impact of doxycycline on gut health. Even at lower doses, this antibiotic disrupts the balance of gut bacteria, which plays a critical role in digestion, immunity, and even mental health. Frequent antibiotic use can lead to an imbalance known as dysbiosis, which has been linked to conditions such as irritable bowel syndrome, depression, and autoimmune disorders. Although the study suggests that lower doses may be less damaging, they are not without risk, and patients should be made fully aware of the potential long-term effects before beginning treatment. Another pressing issue is the role of antibiotics in driving antimicrobial resistance. The more antibiotics are used, the more bacteria evolve to resist them, making common infections harder to treat in the future. The rise of drug-resistant strains is a global health crisis, and dermatologists prescribing antibiotics for non-life-threatening conditions, such as hair loss, may be contributing to the problem. The study's authors suggest that using lower doses could mitigate some of this risk, but it does not eliminate the fact that any antibiotic use contributes to resistance. Patients seeking treatment for hair loss should consider whether the benefits of antibiotic therapy outweigh the broader risks to their own health and public health at large. Despite the study's findings, questions remain about the necessity of using antibiotics at all for this condition. The root cause of lymphocytic scarring alopecia is an immune system attack on hair follicles, meaning that alternative treatments targeting immune function or inflammation could be explored. Some studies suggest that dietary changes, stress management, and non-antibiotic anti-inflammatory treatments may play a role in managing this condition without the risks associated with prolonged antibiotic use. While doxycycline may provide symptom relief, it does not address the underlying immune dysfunction that causes the disease. The study also highlights another ongoing problem in dermatology: the tendency to rely on antibiotics as a first-line treatment for chronic skin conditions rather than seeking alternative, sustainable solutions. While lower doses of doxycycline may seem like a safer option, they still expose patients to unnecessary risks, and overprescription may continue to fuel antibiotic resistance. More research is needed to identify better long-term treatment strategies that do not rely on antibiotics, ensuring that patients can manage their condition without compromising their overall health. For patients considering doxycycline for lymphocytic scarring alopecia, it is essential to have a full discussion with a healthcare provider about the potential risks and benefits. While lower doses may reduce some immediate side effects, they do not eliminate the concerns about gut health, antibiotic resistance, or the lack of a long-term solution for the condition. Exploring alternative therapies, adjusting lifestyle factors, and seeking second opinions from specialists may be necessary steps in making an informed decision about treatment. The convenience of an antibiotic prescription should not overshadow the broader risks it carries, and both patients and healthcare providers must weigh these factors carefully before proceeding with long-term antibiotic use.